Cuba's anti-COVID-19 vaccine candidates Soberana-02 and Abdala are entering the second dose of Phase 3 clinical trials this Monday. The two formulations are part of a list of 24 subunit vaccines being developed globally, also included in the group of 16 that are currently advancing in the third stage of their trials. This period's main purpose is to evaluate the efficacy, safety, and immunogenicity of the anti-SARS-CoV-2 vaccination which causes the disease. It is also characterized by being multi-center, adaptive, parallel, randomized, placebo-controlled, and double-blind. Soberana-02 from the Finlay Vaccine Institute was the first formulation to start the study last March the 8th in the capital with 44,010 volunteers from 19 to 80 years of age. The National Director of Epidemiology of the Cuban Ministry of Public Health, Dr. Francisco Duran, reported on Monday 1,066 positive samples for COVID-19 during the last 24 hours, for an accumulated of 18,610 diagnoses and 436 deaths since the beginning of the disease in the nation. No fatalities were reported today. In his televised briefing to the nation, Duran said that the island's 23 molecular biology laboratories processed over 21,000 samples for the diagnosis of the disease, and that 5,000 active cases are admitted to hospitals. Havana continued to report a high number of infections with 556. It was followed by Granma with 124 and Matanzas with 118 cases.
You are listening national news from Radio Havana, Cuba.
Cuban Foreign Minister Bruno Rodriguez criticized the inequality and poverty that prevent millions of citizens in the United States from accessing health services. On Twitter, he reiterated the negative impact of COVID-19 on the people of that country. The U.S. could have avoided more than 400,000 deaths due to the COVID-19 if it had had an effective response to the pandemic, according to experts, he wrote.